Good morning, everyone. Welcome to our Retiree Town Hall. My name is Brad Pacheco with CalPERS, and I'll be serving as your moderator today. It's our privilege to host today's town hall and introduce your representative on the CalPERS board, Yvonne Walker. Before I do that, I'd like to explain the format for this meeting. Ms. Walker will be providing some updates on CalPERS, and then we'll take any questions you have. Everyone is in a listen-only mode. When there is time for questions, you can raise your virtual hand and we will open up your line and call on you. You can find that feature at the bottom of your screen under reactions, or you can type your question in the question box. And if you want to turn on your closed caption, you can also find that at the bottom of your screen as well. This is being recorded, so we will make it available to you and to other retirees that may not be able to be here today. We have an hour together, so we'll make the best use of our time. If we don't get to all your questions, you can email them to our team and we'll provide that contact information for you at the end of the program. With that, I'm pleased to introduce Yvonne Walker. She is serving her first time on the CalPERS board, her first term. Yvonne has served California and our nation for more than 35 years, working as a union president, retirement security advocate, state worker, and a Marine Corps veteran. She is known for being one of California's foremost leaders in fighting for the pension and health benefits that you have earned. So please join me in welcoming Yvonne Walker.
Hi, thank you, Brad. Appreciate it. And welcome, everybody. I'm going to ask you up front to give me just a little bit of grace as we're going through this. This is our first time. It won't be our last, but just to make sure, that we're doing this. So again, I thank you for joining me on this Zoom. Some of you might have noticed that I have not been in person at the CalPERS board meetings, and I have been unable to attend any of the chapter meetings in person. And so I wanted to start this as a way to for us to stay connected until I'm able to get back out to the meetings and everything else. And hopefully that will be soon, depending on my doctor. So let me just start with the health of our fund, because that's one of the main things that come up, like, are we doing good? Are we doing okay? Are my pension benefits good? So we have $494 billion in assets. We're roughly 74% funded, and the return for the first 9 months of the fiscal year has been 7.8%. So all signs are pointing in the right direction. I think this is very good. Also, some exciting news. We had, after an extensive search, we have hired a new Chief Investment Officer, Stephen Gilmore. He's a senior investment leader with extensive experience in public and private financial institutions across cultures and geographies, and we hired him as our CIO. He was a chief investment officer for the New Zealand Super Fund since 2019. He has overseen the world's best performing sovereign fund with annual investment returns of more than 12% a year over the past decade. He was a chief investment strategist of the Future Fund, Australia's sovereign wealth fund. He oversaw such efforts as portfolio strategy, portfolio overlays, and investment risk. He has also held senior international positions with AIG Financial Products and Morgan Stanley, as well as assignments with the International Monetary Fund and the Reserve Bank of New Zealand. As Chief Investment Officer, he will oversee a team of more than 300 investment professionals and a portfolio valued at $494.6 billion. He will come, and he's coming at just the right time after we have launched our Sweeping Sustainable Investments 2030 plan, which includes investing $100 billion in climate solutions over the next few years. Also, as we think about investments and what we're doing, this is something that I'm very excited about. CalPERS has partnered with Stanford University, and we've created a long-term investing fellowship program. And it's a collaboration to develop the next generation of intentional of institutional investors. And this will give us the opportunity, right, to kind of grow our own, and get our next financial leaders familiar with CalPERS, how we work, develop relationships. I think that this will be a very productive program for both the students and CalPERS and us in general. So, and then, I'm going fast because I want to make sure that I leave a lot of time for questions, and it's a lot harder because I can't see all of you. So if I'll moderate as I go along. So we're all getting COLAs. Yay for me, because this is the first year that I'll get a COLA. This is, the COLA takes effect the second calendar year after retirement. It's a 2% increase for most school and state retirees, and we'll see it in the May retirement benefit checks. And so if you want to track your new payment amount, you can, log onto the website, go to your My CalPERS account. You can use the automated phone system. That's 24 hours a day, 7 days a week. And another new option is we have a My CalPERS pay warrant app for your mobile phone or computer. You can download that. And with that, you can view your check detail, your gross and net amounts, plus your deductions and taxes. Again, you'll be happy to know that security is paramount for us. So you'll be guided through an authentication process each time you use these services. And so, I hope you take advantage of it. And then I want to move on to healthcare, right? So we saw some significant increases in healthcare, particularly in Kaiser. I first want to assure you that our team is continually focused on ways to lower healthcare costs, improve healthcare outcomes, and access to high quality healthcare services when and where you need it. And on a personal note, I have, you never know how good something is until you actually had to use it. And so I just want to commend our CalPERS staff for the outstanding health insurance that they've brought to us, right? It has been pretty amazing for me. One of our most important opportunities we have is using our leverage to hold the health plans accountable. We hold them accountable for the quality of service they provide, the regions where they provide care, and for improving care of our members' most chronic health conditions. And we just kicked off a process where health plans are coming to our board meetings to discuss the care they provide our members. We want to look them in the eyes, ask them tough questions about costs, not just about costs, but about care and what exactly they're doing for our members. Our first health plan that came in was Kaiser. Their increase this year was too high, and we made that very clear. And so as we go on with the other health plans, we'll continue to ask the hard questions to make sure that you're getting the best care for the right price, right? We are in the middle of negotiations for next year. And our hope is that plans like Kaiser get the message that, enough is enough. We're also revamping our contracts with our PPO plans for the next 5 years. And we're going to use this opportunity to reduce year-over-year volatility in the premiums and incorporate stronger clinical requirements like controlling blood pressure, diabetes care, and colorectal cancer screenings. And so, I know these are all words that sound very nice, and you're going to wait to see results, but I promise you that as it goes along, I'll continue to report out, and I won't stop until we get what we need. And then I've noticed at the last few board meetings, we've had many retirees coming up and asking us to take over the state's dental insurance plan, Delta Dental. That plan is run by CalHR, and there are no plans to move it to CalPERS. But I would encourage you to engage with CalHR like you do with us and express your concerns about the care and the costs. All right, and then I want to talk, I think I'm gonna end real quickly, but talk about climate change. There's a lot said on this topic. Some of it is, unfortunately, a lot of misinformation. So I want you to be clear on what it means to us. For CalPERS, it's how well we measure risk, and climate risk is at the heart of providing retirement benefits to our members. We actively manage climate risk to preserve long-term value for our members. It's part of the fabric of our investment analysis and a strategy to help drive better investment returns for the long term. And I recognize that many of you have opinions about what we should or should not be invested in. And we hear your concerns. We take actions with companies to make sure that they are in line with our fiduciary duties. And so this is not something that, that there is an easy fix to, but it's something that we are totally engaged in. With that said, I'm pleased to announce that Michael Cohen, our Chief Operating Investment Officer, has been appointed Steering Committee Chair of Climate Action 100+. It's a global organization of investors working with the world's largest companies to fight climate change. Climate Action 100+ represents more than 700 institutional investors engaging companies to improve their climate change governance, cut emissions, and strengthen climate-related financial disclosures. So I think that I've talked enough because we have an hour, and I want to make sure that I leave enough time to get your questions. So if you have a question, go ahead, raise your hand, and we'll get you in. And looking forward to hearing from you.
All right, thank you, Yvonne. Thank you for those comments. We do have several questions, as you can imagine. So,
Oh, yay.
Again, if you do have a question, you can raise your virtual hand that's down under the reactions button. You can just raise your hand, and then you can also lower your hand. And I see that many people have submitted questions in the question box. So for those that have raised your hand, I'll start with some of those folks first. We're simply going to call your name, and our team behind the scenes will take you off mute. And so you can ask your question live to Yvonne. So I'm going to start with Bernice Corley. And Bernice, I believe we've brought you in. You can go ahead and ask your question.
You got to take yourself off mute, Bernice.
Yes, Bernice.
There you are.
Go ahead, Bernice. We're not hearing you, Bernice, if you're talking.
So let's go to the next one, Brad, and we'll try to bring Bernice back in later.
Will do. I'll see if our team can help you, Bernice. So next person is Mario Ingrazzi. I hope I pronounced that correctly. Mario, if you could take yourself off of mute and ask your question.
I'm sorry, I don't have a question. I don't know how my name got in there, but it's not easy to find it.
Were you just
Oh.
saying hi?
Hi.
Hi.
Hi, thank you.
All
Thanks,
right.
Mario.
Thank you, Mario. We'll go on to the next person, Antoinette Lobo. Antoinette, if you can remove yourself from mute, you can ask your question.
Good morning. This is
Good
Antoinette.
morning.
So my question is about health insurance out of state once you retire.
Mm-hmm.
So we've moved out of out of California, and in Hawaii, to continue with Kaiser Permanente, there's a $300 per month, not deductible, but it's towards the premium.
Uh-huh.
And so for two of us, that's $600 a month. And so I want to find out if there's any way during the negotiation process that that could be lowered, because in California, our Kaiser, we have no premium that we have to pay. But in Hawaii, moving to Hawaii, we do, and the cost of living is higher than it is in California. So it's it's a difficult situation.
I can imagine. So I will certainly bring that up to our healthcare team.
Yes,
And then to see if there is any other option for you. And I know you probably want to keep Kaiser, but if
Yes.
there's another option that might make it, cheaper for you, I want to
Yes.
see if that's available also.
okay, I appreciate that. Thank you.
Sure.
Thank you, Antoinette. And our health team is actually currently in negotiations on rates for next calendar year, so that's timely. Next, I see Dev Berger. Dev, if you can take yourself off mute and ask your question.
Good morning. Thank you for being here today.
Hey, Deb.
You indicated that you are, of course, an advocate for us and also for cybersecurity.
Yes.
Based on that, will you work to get member education to provide adequate training in cybersecurity so that the many, many members who never signed up for protection can at least have an avenue to learn how to address phishing scams? Many of us have already had our credit cards compromised and had to change them. So the problem exists and will grow. And I think it's something that CalPERS could step in and go to its members' education and create something that would make the members and CalPERS proud.
I think that's a very good solution. I will have conversations with Marcy about that, because I think we can create like what is it, like a YouTube video, right? For the different things to look for and how to go. But I think it's a very good suggestion. I don't know the exact platform, but I'll certainly look into see how we can get that done.
Thank you.
Thank you, Dev. And we do have some content on our website around cybersecurity, but we'll make sure to share that with everybody and pursue that a little further, as Yvonne has mentioned. I'm going to take a peek here, and I'm looking off screen for these questions for a question in our question box. Lots of questions, Yvonne, about the current status of our long-term care program. And I know the board talked a little bit about the valuation of the program. It is currently closed to new participants, but wanted to see if you had anything to add there.
I don't have an update at this time.
Okay, very good. Let's go to the next question. All right, I see Chris, KRISW. If you can come in and you can ask your question live.
Hi, yes. What was it that you said, Yvonne?
Yvonne, yeah, it's okay, Chris.
Yvonne. What was it you said right after the 492 billion in assets?
Oh, let me go back. 492. Oh, it's 74, roughly 74% funded.
Okay, great. And also, I don't imagine there's any kind of answer for this, but I'm just amazed at the fact that we're only getting 2% COLA, even if it was predetermined a long time ago. The cost of living has gone up so much, and that just seems, everybody else that I know that gets a retirement gets way more than 2% increase. Is there any talk about changing that?
No, as I understand, that 2% is it's statutory. And so I don't know how CalPERS would go about changing it. It would probably be better to go through your retiree organizations, because it's a law change, right?
I see. Wow. Okay, that answers my question. Thank you.
Okay.
All right.
Thank you, Chris. Next, I see Andrew Manthe. I hope I pronounced that correctly. Andrew?
Yeah, I'm wondering, this is probably a question no one can answer, but when we move to digital dollars, how will that might affect the whole program?
I have no clue, Andrew.
I thought that would be the answer.
Yeah, you are outside my area of expertise.
All right, Andrew, maybe you can follow up with a question, about what you mean by digital dollars. Appreciate it. I'll go to the next question, and that is David B. Go ahead, David.
Oh, yes, a couple of questions. One regarding the 960 fiscal hours that we retirees can work and contribute back to our public schools, parents, and communities. Those numbers are way too low, 960 per fiscal, for many, many years. And I've been sending notes to the governor as well as your board members to increase those hours because, since post-pandemic, we have been, our schools have been suffering with many, many shortages, from janitors to security to teachers. And we just can't contribute for the whole school year in assisting our communities. Now, why has that number not been changed over the years? That's one question. My second question is, during the pandemic, you guys went back 6, 7, maybe 10 years to rectify your books and getting over hours to get the penalties, reimbursed to you. But 6 or 7 to 10 years without any notices that we even had clue that we went over our workage hours. Obviously, I'm one of those workers that still can contribute a lot of value to our public schools, and the hours is just not enough. Why is that? Thank you.
Okay, so in regards to the retired annuitant hours, right? There are, I know that we worked on last year, and I think that there's work continuing to be done administratively on making sure that it is more uniform across the board. One of the things to remember about the 960 hours is that when you look at retired annuitants, right, they are more of a contingent workforce than the actual workforce. And so I know that there are ways that each individual employer can, at least 2 years, right, increase the hours. But this, I will tell you, is a sticky subject, right? Because it's, you're balancing out different needs.
Yeah, and I would just add, it would require a law change. Some cities are trying to address that individually. There is a piece of legislation that we shared with our board yesterday where a city is asking for an exemption to the 960 hours, but it is a law change, David.
Well, you being a $1 trillion billion pension company, why can't you be our advocates and go up to Sacramento and push harder? I mean, our communities, our people, our students are suffering because there's just a lack of shortage. These positions, these people are overwhelmed, burnt out, and they could use I don't know, I guess you could call us OGs in the system. I mean, we have a lot of values. A lot of us still have a lot of value to contribute and help. And then when we have to leave after 4 months because our hours are exhausted, it's a complete letdown from administrators to students and parents. And, even the kids get emotional. Oh, you got to leave and you can't come back till July 1st. You guys, I don't know if you're seeing this on the ground level, but it's really heartbreaking, and it's a need that needs to be changed, and it needs to be done. And I just don't understand why you guys are not pushing hard enough in Sacramento for us. We can't do it as retirees. And then another thing, as an annuitant as working, why you don't have a software program to keep count of the hours for us. We get so busy working with our lives, busy working at the school level. And then a lot of times we go over, and then we have to go with the administrative judge to pay back the penalties. That's something that could be fixed in a software program where we wouldn't be up, that wouldn't happen, and we wouldn't go over the 960 hours and be penalized, which brought me back to my second question. During the pandemic, I didn't even know after 7 years that I went over my hours 7 years ago, and then you guys come back to get all that money. And there was no explanation for that. Why did that happen?
I don't know. That was before my time. But I know that CalPERS continuously, goes back to make sure, because part of our responsibility, right, is to make sure that, everybody is getting the funds they're supposed to have and not going over. I would say part of the responsibility, actually the whole responsibility, is with the school district that is not tracking that, right? That is their responsibility.
No. I'm sorry to interrupt, but that's incorrect. So for example, we keep track of it manually. It goes into the school district. They have the hours. We see that. We try to verify it. And then it goes to LACO, the county. Then it gets reported to CalPERS. And then sometimes you get a courtesy letter, which is not even accurate on your end. And I think this software program could really either get out, take out the middle person, LACO, the reporting industry, or integrate or link all of this so it's in real time and it helps everybody across the board. And therefore, the retiree annuitants, we don't get stuck. Oh, we got to pay back 2,000. Oh, we got to pay back 1,000. Oh, because we went over the hours. It's a software issue that could be rectified all across the board if it was linked through the website or something like that.
All right, thank you. Yeah, no, thank you, David. Go ahead, Yvonne, I'm sorry.
Go ahead.
No, sorry. I was just going to say thank you, David. I appreciate your suggestion. I'll certainly run it up the flagpole. But I will also say I will still maintain that it is, your school districts, your county education and everything else. They know how many hours that they have in their budget for what they do. And so, but I will still take your recommendation, run it up. If there's anything we can do, we'll see. I'll see if we can do it. And we'll take it from there.
Thanks,
Okay,
David.
thank you very much.
We'll go to the next question, and it's Paulette. And excuse me if I don't get the last name wrong. Gissendanner?
It's Gissendanner. Thank you.
All right, go ahead, Paulette.
I'm in New York, in upstate New York, in Western New York. So I appreciate the question about out-of-state health coverage that came earlier, taught at Cal State Monterey Bay. My questions are two. One of them, Yvonne, you kind of answered at the beginning in terms of Delta Dental. I have lost 3 dentists in the last 4 years here because they're refusing to directly process payments to Delta Dental because Delta Dental is either slow in reimbursing them or they're not reimbursing them as they should. So hopefully something could be done about that. The second thing is that I am suffering some issues that limit my mobility and have picked up a few pounds. My doctor recommended that I use Ozempic or something similar to Ozempic, one of the generics, because she sees that where it's headed, even though I'm doing the chair yoga and I'm doing what I can do physically, the pounds are there. So she's saying, she's recommending I use Ozempic. We tried to run it through and the prescription said, no, well, you don't have diabetes. Well, we're trying to prevent me having diabetes. And so she's trying to do that, but they would not approve it. So I'm wondering when the prescription program will kind of wake up. I heard something on the national news that there is some movement for moving Ozempic and other similar drugs into the wider availability beyond diabetes. So I'm wondering what the thoughts are on that.
So we talk about this all the time on, just the usage of the Ozempic and the drugs like that, right? The new drugs. And so, and that they're very expensive. And so trying to figure out, and it's not just CalPERS, right? It's all of the health plans, trying to figure out the right balance. We're not there yet. There is, I don't remember the name of the drug, but there's a step they want to do before you go up to that, right? And so
I think it's Kismia.
It's what?
QYSMIA. I think maybe Kismia. She recommended that and they would not approve that one either.
Huh. So let me tell you what I want you to do. If
Okay.
you could put in the chat a way to contact you, I'll have somebody get back and talk to you directly.
Definitely, I will do that.
Okay? Thank you.
Yeah.
All right, thank you, Paulette. I'm going to take a question from the Q&A box. The question, Yvonne, is what does it mean to be 70% funded?
74% funded?
74% funded, yes, in your remarks.
Oh, well, what that means is that if we had to pay out today, if we had to pay out everybody today, we could do 74% of the retirees today. That's a simple explanation, I will say, but that's basically what it means.
Thank you. All right, the next question, Mario Ilaraz. Go ahead, Mario.
Hi, thanks for hosting this session. It's really important. Thank you again. My question is, California is expected to spend about 8.7 billion on the state workers' pension next year. And Governor Gavin Newsom wants to offset that cost by repurposing something that was promised 10 months ago for the PERS debt, but he's going to repurpose that for state workers' pension. How will that affect retirees, if any?
It won't have an impact. It's actually good. It won't have an impact on you directly, no.
Okay, thank you so much.
Okay.
Thank you, Mario. Next question is Robert Thomas. Robert?
Yes, my question deals with, is the state of California current on its monthly payments to CalPERS?
I don't think, and I could be wrong, I don't think I am, but I don't think that they pay monthly.
Right, they've historically waited until June and then paid a
Right.
year's worth
Yes.
in June. Well, right now they're $187 billion in debt. What makes you think they'll pay anything at all?
Because they don't have a choice. I don't know if you remember back when Pete Wilson was governor and he took money out of our pension plan to balance the budget. And he was sued by several employee organizations, and he lost. And they cannot take money from our pensions to balance the budget. Then they can't skip, and because of PEPRA, which went in under Governor Brown, they can't skip payments either by law.
Well, yeah, obviously my concern is if they're 187 trillion
Billion.
billion, that's still more money than I got.
Me too.
In debt. I think they're going to end up giving warrants to active employees right now. I mean, they're right on that cusp. And if they're going to warrant employees, then what happens to their payment to retirees?
Well, not in the governor's head, and he's certainly not consulting me on this, but just based on my experience, one, they're not gonna withhold retiree payments. They can't by law. And that's normally not, he is, next to Governor Brown, he is a big advocate for retirees, right? And so I can't imagine him doing anything, and I don't know that he will furlough state workers again. I think he's looking for every solution that he can get to before that, and he's working with the legislative leaders. So, but I don't have a crystal ball, but I feel confident. And when I say I feel confident, because this is my money too. And so I feel confident.
Thank you very much. I appreciate your comments.
Thank you.
Thank you, Yvonne. And the state has always paid their required contributions. Next question is Rich Bakanek. Go ahead, Rich.
Hi, yes, good morning, and thank you, Yvonne and Brad. My question is in regards to the climate change investment. That is a huge commitment.
Uh-huh.
Uh, where are we in that decision-making process? What is the ROI for that, or expected ROI for that type of an investment from this fund? I mean, it seems like it's a huge investment and we don't really know what the forecast is, or how do we determine the ROI for that?
So I don't have an answer off the top of my head, Rich, and I don't want to, blow smoke or anything else like that. Our Sustainable Investments 2030 plan is up on our website. But I will actually have a conversation and make sure that as we're talking about this, right, that we don't just talk about it from the standpoint of like, this is what we're doing, but we're doing this because this is what we want. We're doing this in anticipation of this is how it's going to benefit us, our retirees, and the fund. But I
Okay,
don't have
yeah,
a direct answer for you right now.
all right. Yeah, if you could look into that, because
I
that's
will.
just,
That's a good question. I haven't been asked it before. I would have had a better answer for you.
okay, thank you.
All right, thank you. I see several questions in the Q&A box about the retirement pay warrant application that Yvonne mentioned. And sorry if we added any confusion. It is not an app that you can find in the App Store. It is a link on our website.
Oh, my bad.
No, not your bad at all, Yvonne. We call it an app too, but it is a link on our website that you can utilize on your phone. And I'll make sure that our team shares that with everybody so they have quick access to it. So I just wanted to clarify that. Next question is Matt Goldman. Matt, go ahead.
Yeah, good morning. I wanted to just circle back to the question about COLA and what we as retirees can do about every year falling behind given inflation and the 2%. I didn't quite understand, Yvonne, what you said we can do.
Oh, well, because the 2% for state workers and school workers is statutory, right? So it would require a law change in order to get it above that. And so working with your retiree organization and having them move a bill, to push a bill, would be the most direct way to get that done.
Isn't CalPERS our retiree organization? I mean, isn't that what your role is and what?
No. Just like we have, that we have various retiree groups. We have RPEA, we have the California State Retirees, we have the California Schools Retirees. So there's a lot of retiree organizations. CalPERS is responsible for being a fiduciary for the fund to make sure that the funds are there for retirees and making sure that they're not passing laws that's going to hurt the fund that will then jeopardize future retirees benefits. But if you want to change, the COLA, and that's a law change, and it should go through your retiree organization.
So let's say, I worked for the city of Long Beach for many years. So would the city of Long Beach be my retiree organization?
I don't think so. I don't know if, okay, let me just ask, were you in a union?
Yes.
Okay, what was your union?
Engineers and something. It's been a little while.
Okay, so the engineers something should have a retiree branch, right? So I would start there. If they don't, I would recommend that you join RPEA, which is a retiree organization that does retirees across the spectrum.
Okay.
And Matt, we'll put contact information and share with everyone on the retiree associations that advocate on behalf of retirees that Yvonne mentioned. So we'll provide that information to everyone.
Okay, thank you. I appreciate that.
Sure.
Next question is Mary Wig. Mary, go ahead.
Oh, hi. Can you hear me?
Yes,
Yes,
Mary,
we can.
how are you?
Okay. I'm good, thank you. I was just, I had a recent experience with a health plan. In fact, I'm in it right now, and I see so much opportunity for improvement in administrative processes at the health plans that are just unacceptable, especially in just the time it takes for them to get certain things done. And it just seems like there are a lot of added costs that aren't necessary. And I was wondering if there's anything CalPERS is doing to analyze the impact of those costs and the efficiency of the plans to maybe find some opportunity for greater efficiency and savings and pass that savings on in reduced increases. Anyway, that's my question.
Okay, so Mary, I know the team looks at that all the time because it's not just, oh, hey, are we, we're health insurance and we're providing this, but it is, what is the experience of our members? Is it done at the right cost? Could it be done in a better way? Healthcare in the right way? So we look at this all the time. What would be helpful is that, if you're having experiences with your healthcare company that you think are not, that they're not providing the service that you think they should, you should call in or email in a message to our healthcare team, right? So, and I will tell you, they pay attention to all of this, right? They ask the questions and, but it's a constant state of improvement.
Yeah, I have a grievance in process right now with my health plan, and so it has to do with how they subcontract and how they pass the responsibilities around, and it's so inefficient and it is so detrimental to the members. And I worked for the health program for many years at CalPERS, and it's just frustrating to see the level of inefficiency at a company that's the largest healthcare company in the United States. I mean, it's just unacceptable, and they can really do better. And I just think CalPERS needs to take a really good hard look at that. And I'm glad that you're calling the health plans in and talking to them about it. They're so quick to take our co-payments, and they're so slow to reinstate benefits when there's a problem, and it's just unacceptable.
Oh, I agree.
They can do so much better.
I agree. I will say though that like I said, you never know until you're actually going through it and experiencing it. And so, but I have been pleasantly surprised, that my provider, they set up a team around me, right? And so it was not just my doctor, it was a social worker, it was somebody for the pharmacy and everything else. And so I had a one-stop shop, right? And their role was to problem solve before it got to me.
They do better when it's actual medical. The problem I'm having has to do with the hearing aid benefit and how it works with this particular plan. And just as an aside, I think CalPERS needs to look at that benefit because it really isn't. Yes, because it really isn't adequate to cover the technology that is required to really give a person a good experience with the hearing. And I think these large companies, they should be able to do a lot better as far as how the plan I'm with actually has a separate hearing company, and the benefit isn't sufficient at all to cover the level of technology. And in fact, we can't even get the best technology because it's just not allowed. And it's very frustrating to see it. And so anyway,
Okay,
I
I
wanted
made
to
a
bring
note.
that to your attention.
Thank you. I made a note and I'll bring it up to our healthcare team.
Thank you.
Thank you, Mary. Next question is Judith Shirley. Go ahead, Judith.
Hi, I was just wondering about the long-term care. I know you'd already said you didn't know anything about it. In some of the letters that we've received, they were saying there was going to be an increase this summer in what we pay. And I'm concerned because I don't know how much it's going to be, and it sounded astronomical when they were giving us numbers previously. So I'm just wondering what's, what is with the increase? Are they going to, we had heard that it was June, at least that's in my, my memory. Yeah, I just don't know. Are they going to do an increase this summer, and when will we find out?
So what I said was I didn't have an update at this time. But I would ask you to continue to look at the website because they put stuff up on the website. But just at this moment in time, I don't have an update for you.
I know that we, had to decide because there was the whole
the
lawsuit.
lawsuit.
And so I had decided to stay with CalPERS because I still felt that it was a good plan. But I feel trapped because what if it turns out that the increase is going to put it in a place where I simply can't afford it anymore?
Right.
So I'm concerned. I know it was a very wonderful idea to do, but from what I understand, a lot of insurance companies backed away from doing long-term care coverage, period, because it's so expensive.
Right.
So I'm trying to plan ahead. That's all.
No, I get that. I get that. And it's hard because, and you're right. When it first came out, everybody thought it was great, but they did not use the right actuarial experiences for that. And then it came in more expensive than anybody thought. And a lot of companies, stopped providing that service. So it's a
so it will be sent to us, not in a letter. It will be just up on the website.
No. But I mean, you'll get a letter.
Okay.
If they're raising rates, you'll get a letter, but also, just check the website periodically if you're looking for updates. I just don't have one right now. That's all.
Okay. All right. Thank you.
Okay.
Thank you, Judith. I know we have several questions about long-term care, so we'll do our best to get an update to everybody. Next question is Ty Johnson. Go ahead.
Can you hear me?
Yes, Ty. How are you?
Great. Thank you. Thank you for taking my call.
Of course.
From 1978 to 2017, state employees were secure in knowing that if they met the prescribed benchmark, that their retirement and healthcare benefits would be covered 100%. Their spouses are at 90%. Inconsistent with the 2017 government code, as president of SEIU 1000, you publicly took a contradictory stance and proclaimed that making sure retiree healthcare is there for us in the future is a crucial priority. However, paying it toward pre-funding it will make it a protected right for us, which it currently is not. As a former 1000 member, under your leadership, we experienced how our protected rights were discarded, and a new expense of pre-funding retiree health benefits was a result of your direct misinformation. So my question is, currently retiree health benefits are a protected right. As a board member representing retirees, are CalPERS earned retiree health benefits at risk of being modified under your representation?
So 2 things or 3 things or 4 things. So no, there was not a misrepresentation on my part. Retiree benefits were not a protected benefit for any of us before the law changed. And they had a court case, I believe it was Stockton, that an employee organization sued over. And the judge ruled that because employees were not paying into their retiree health benefits, it was a gift from the employer, and the employer could decide to take it away. So we made the strategic decision to say, you know what, we want to close that loophole. And if it means we pay a little fit while we're working to ensure that we have it in our retirement when we're not working, it seemed like the right way to go.
That's, I appreciate the background on that. However, as I've mentioned, Government Code 22871, that outlined, that the prescribed benchmarks. Under that section, though, it also said that the memorandum of understanding shall be controlling without further legislative action, and that our memorandum of understanding had to change in order for that government code to be changed.
Yes. Yes, I still think today, as the retiree representative, and as I thought then, as a president of Local 1000, I thought it was the right decision to be made to ensure retiree health care, not just for today, but into the future.
Thank you, Ty. Next question is Erica Dennings. Erica, go ahead.
All right, can you hear me?
Yes, Erica.
Good morning. Thank you so much for having this. I'm not sure if you've had these before. I don't think
I have not. This is my
Oh,
first
okay,
one.
good.
This is the inaugural one, so I'll be waiting for feedback on it.
Fabulous. Well, my feedback is it's great. I really appreciate it. I'm learning information from questions that others ask as well. I had two comments and one question. One of my comment is that I know that I've heard other people talk about their experiences with PERS. Some things I think may not be in PERS purview, but my experience in the year and a half, I guess, that I've been retired has been really excellent. Actually, leading up to that as well, I found PERS to be one of the best run agencies that I've had to deal with, and I worked for an agency, so.
Oh, there you go.
I really appreciate that it was really, really very quite good in terms of, getting information about putting in my paperwork to retire, et cetera. And even since then, it's been really, really smooth sailing, excuse me. And I really appreciate that. The question that I have is about, I have healthcare benefits through my employer or former employer. But the way they do it, and I'm just curious as to whether that's them or PERS and my employer, they pay, like, so let's say the amount is $1,000 a month. My employer pays, I think they pay 80%, I pay 20. So let's say I pay $200, they pay $800. But the way it works is that PERS deducts the amount, the whole $1,000, and then my employer reimburses. PERS deducts on the first, but the employer doesn't reimburse until the end of the month. So I just wondered, and I don't know if you know the answer to this, whether that's something, is there any way to change it? So, because it's like, it's a month, basically.
It's a lag. It's a lag.
Yeah, it's a flag. Thank you. That's the right word. And so I don't know if that's something that just PERS and my employer worked out, or do I go back to my employer? I'm trying to, come at it from both ways to see if there's any flexibility there so that the lag can be minimized. Does that make sense?
It makes absolute sense. You're right. I don't have an answer for it. But it's the first time I've had this question, so I will forward it to somebody to look into. I mean, maybe there's not an answer. Maybe it is, you have to go back to your employer. I don't know.
Okay.
But I will certainly look into it and we'll get back to you. How's that?
That's great. And then my other comment or sort of question was, we have our benefits are through CalPERS, our health. Oh, is there one other? Maybe that's it. And then the other benefits that we got through, I think CalPERS must do vision as well, but we have, dental and EAP. And so is that also a function of what the employer negotiates with PERS? Because I've heard other people talk about dental benefits or things through CalPERS and Delta Dental. So I'm just not sure. My Delta Dental and I think EAP are through Task, which I imagine you're familiar with as an administrator. So I just don't know. The reason I asked—
Actually, no, I'm not familiar with it. Let me just say.
It's just a healthcare administrator, but if I have a preference to have CalPERS administered versus the other people, I would gladly do it. I just don't know if that's an option.
Yeah, I don't think it is. So I will just tell you, my expertise comes from state workers. So if you're an outside agency, I'm getting up to speed, but I'm not there yet.
Oh, okay.
And so CalPERS doesn't do dental. They do not do
Okay.
dental.
Gotcha.
Right. And then I know with if you're Medicare or with some of the Advantage plans, they might offer vision, but that depends on the plan.
Yeah. I just wondered, we actually, the vision also comes from, you know, my employer having, you know, a continuation.
Okay.
Just that they admit, I didn't know whether CalPERS can administer it. I don't think that they are. Well, they must be, now that I think about it.
Yeah, I
Anyway,
think
so
they do vision because I signed
they
up for
do.
it. I had to sign up for it.
Now that you mentioned they do, because Task is only doing, as I said, dental.
Okay.
And be the employer, like where you get if you need mental health. So,
Right.
okay. Thank you for that information. Appreciate it. And keep
Good
up
that we talked that through, though. I appreciate that.
keep up the good work.
Thank
Thank
you.
you, Erica. All right, our next question comes from Catherine Courtnier. Go ahead, Catherine.
I'm kind of off the charts here. I would like to know some more about Medicare or where I can go to get more answers regarding Medicare. Can you help me with that?
I'm in the same place as you, Catherine, and I'm actually currently researching that. I'll be 65 in July. And so you know.
Is there some place I can go, like a YouTube video to watch or something regarding Medicare?
Well, yes, we do have stuff up on the website for Medicare. So I start there. And then you can go to medicare.gov, right? Also to look there. But yes, we do have resources up on the website.
Because it says that you need to start 3 months before your birthday and 3 months after your birthday is what I've heard. So I'm like,
you have a window. So, you know, if nothing else, you go on the website and sign up, right? You got to sign up for A and B. And then did CalPERS send you a letter yet?
no.
Okay.
Will they send me a letter?
Yes. Yes, they will. They send you a letter, I think at 3 months out. They'll send you a
Okay.
letter. I got mine.
All right. And that's all I needed an answer for. I'll check
Okay.
the website. Thank you, Yvonne. I appreciate you.
All right, Catherine. Thank you.
Thanks, Catherine. We have time for just a couple more questions. Diane Dreyer. Go ahead, Diane.
Okay. Hi, I'm a retiree, and this is the first time I participated in one of these, and I just heard it's the first one. So thanks for doing these. And let's see, I've joined thousands of CalPERS members objecting to our pensions being invested in fossil fuels, which absolutely cause the climate crisis. What is the CalPERS plan to move out of fossil fuel investments and move into investments which will improve people's lives now and into the future? The world is in crisis.
Yeah, I agree. And that's why we have our 2030 plan. And that we're working on, and we're going to be making billion-dollar investments in climate solutions over the next 6 years. And so, you know, we are working on this because, you know, I mean, we all know, like fossil fuels, they're here, but it'll be like coal. They'll, you know, it's going to fade out. And so you've got to, you know, look into the future also. And that's what we're doing.
All right, thank you for that. And one last question from Jeff Halpert. Go ahead, Jeff.
Good morning. Thank you so much. Appreciate it.
Morning, Jeff.
Good morning. I just wanted to start off with a quick comment before I ask you my question, similar to what other folks, but it always does well to state that I love the CalPERS staff.
Me too.
It's the one state agency I think that is what right looks like, and always appreciate they're super helpful, cheerful. They're just awesome. So I just wanted to mention that, and please share that.
I will.
The question I wanted to ask you about is regarding, and you've touched on this on a few other questions regarding pension reform, PEPRA, and so forth and so on. There's two threats to our pension. One is the government, the state's insatiable appetite to spend money. And number two, the public perception, negative perception about our retirement system. So that puts us in a danger. And that's kind of what led to PEPRA and all that good stuff. I just wanted to get your assessment on what is the near future or far future look like for our pension. Are we in danger? Are there, is there people looking at our 47 something billion dollars with, salivating at the mouth? Just wanted to see what your thoughts are on that.
Well, so first off, you got $47 billion. Somebody's always going to look at it and try to figure out how I can get a piece. that is just human nature. But I will say, I have tracked pensions, both as a leader at Local 1000. I was on the, led the pension committee at our international. And I will tell you, I feel more hopeful that our pensions are secure, not just because it's CalPERS, and I agree with you, CalPERS is great, right? But because we don't have the same level of pension envy. I've been reading reports and studies, and private industry is starting to see, at one point everybody had defined benefit pensions, and then they went into 401ks, and they're realizing that is not sustainable. And so they're looking at more kind of hybrid plans, right? And so those are the conversations that are happening now. I, for one, will keep monitoring it. I know CalPERS will, because one of the things that we have to do is to make sure that we're not an island and that everyone has the opportunity to have a good pension and can retire with dignity, right? And until we do that, there's always going to be a tension, but I feel a little more comfortable now. But it's like Coretta Scott King said about civil rights. This is something that we're going to have to continue to fight for, and we can't be snoozing on it, right? But I do feel more comfortable now than I would have 5 years ago.
Thank you so much. Appreciate it.
Thanks, Jeff. I think those are some good words to end our first retiree town hall. I want to thank everybody. I want to give Yvonne an opportunity to close, but as expected, we had a lot of questions, and I know that we weren't able to get to all of them. This was our first time doing this. We will follow up with everybody and their questions, but with that, I'll just turn to Yvonne just to close us out.
I just want to thank all of you. I appreciate the engagement. Looking forward to the opportunity to get back out with you. But I will tell you, my thoughts are to make this a every other month thing that we can do. And if you have any suggestions, go ahead, send them in about how we can make it better. Because again, this is the first one, and the first one's not always perfect. I like to think that we're like Mary Poppins and try to be practically perfect, but we're not quite there yet. So I'll appreciate your suggestions. And with that, have a very good day.